everyone. This is Tracy with the Oasis for Natural Healing. Just kind of waiting for people to kind of jump on. So, yeah. Tonight we are going to be talking about parasites, headaches, and migraines. Fun stuff. I don't know what the weather is like out for you guys, but here in Chicago, it's a little bit dreary. It's a little bit rainy. So kind of chilly, but not too bad. Kind of a little bit different for January for Chicagoland weather. So anyway, just waiting a few more minutes. So we'll get started. But yeah. So I don't know what the weather is like out for you guys, but fun times. So all right, let's go ahead and get started. So let's talk about parasites and headaches. So a lot of people, suffer from parasites or from headaches. A lot of people also suffer from migraines. They're debilitating, right? You have a migraine, and you're out for the count. And sometimes if you're lucky and you catch it, soon enough, with medications like Imitrex and some other medications, I don't know if any of you guys are like on medications to kind of help prevent migraines or headaches. There's a blood pressure medication out there like propranolol. People can be on that, to sometimes there's other medications that can also help to decrease the amount of headaches or migraines that you have in a month. But is it really getting to the root cause of why you have your migraines and why you have headaches frequently? Okay. So I don't know about you, but even if I get a sinus headache, I can handle almost any other pain except for headaches. Headaches are just horrific. Like, I'm miserable. I don't know if you guys are. You guys get moody, you're irritable, you can't seem to tolerate things, as well. You just kind of want to be, it's really hard to concentrate and function, and if you get a migraine and it's really debilitating, I've had patients where they're down for like a day, or a minimum of several hours, if not a day or two. And sometimes these headaches can last for a good couple days, and they're missing family functions. They're missing, work. They're nauseated, sound bothers them, light bothers them, right? It's not so fun. So I don't know, have you suffered? I know we have a couple people on, I'd like to say hi. Diana, Trey joined us. But yeah, if you guys are suffering from, headaches, I don't know, how long does it last for you guys? So like I said, a couple days for most of my patients. But let's talk about, why you have headaches. When as a holistic nurse practitioner and doing this for for several years, maybe about 7 years now. Has it been that long? Yeah, it's been about that long. 8 years? We're going on 8 years. Good Lord, the time flies by. So I see there's actually a couple different things. I see a lot of heavy metals and a lot of heavy chemicals that actually settle into the brain tissue. Okay. But I also see a lot of parasite. Was that the fire alarm? Oh, that's outside. So there's an alarm going out outside. Sorry about that. So, and I also see parasites. Okay. How do parasites get in the brain? All right. So first off, let's talk about how you get parasites to begin with. So parasites can be from insect bites. You can get them from mosquitoes. Okay. You can get them from other insects. I actually previously posted a video of them pulling out somebody pulling out a parasite out of a hornet. Was it a hornet or a wasp? Regardless. So you can get them from insect bites. Okay, there's microscopic parasites and larger parasites in large bodies of water, the lake, the ocean. They're in our tap water. So they're pretty much found in a lot of different places in the soil. So if you garden, and you get soil underneath your fingernails, you can get parasites from eating sushi or from eating medium rare to rare cooked foods. Who likes a good medium, rare or medium rare steak? Okay. These are ways that you can get parasites. You can get them from your pets. And I'm not saying to get rid of Fido or Fifi, but you can get them from pets. Okay. So pretty much you're going to be exposed to parasites if you live on planet Earth. Okay. If you're a human, you're going to get exposed to parasites. You're an animal. All right. And I've said this before, and I'm going to say it again. You're an animal. We treat animals for parasites. Why are we not treating people for parasites on a routine basis? In a lot of other countries, they do parasitic cleanses routinely because you're going to always be exposed to parasites. That's just a given. Okay. So what are some other symptoms of a parasite infestation possibly? So you got headaches, and I'll explain on how parasites can get up into the brain, but parasites can actually go traveling and migrate anywhere in the body. So if you ingest them by mouth, or if you get injected, by a mosquito bite, they can get into your bloodstream right away. Okay, because those insects are biting and digging into your capillaries or your blood vessels, and because that's what they're sucking out. They're sucking out blood. Well, guess what? They're gonna inject, in the same token, parasites right into your bloodstream. Well, if it's in your bloodstream, it goes migratory. Okay, so that means it can get deposited anywhere in the body. Okay, into other organs. Okay, not just the brain. So thyroid, I've seen parasites in thyroid. I've seen them in the sinus cavity. They can be in the ovaries. They can be in the testicles. Okay, they can be in the uterus. That's another fun story. I had one patient, and we're going to get down and dirty because this is a holistic practice. And I also do nurse practitioner. So hopefully you guys can handle this. So I had one patient, she had chronic bacterial vaginosis. And I was muscle testing her. And she came up for parasites in her uterus. And she, at this point, she was being tested, she was being treated every single month with oral and suppository antibiotics. Okay? And they just were not cutting it. And she didn't want to be intimate with her husband anymore. So this was affecting her relationships too now. And she just didn't feel good. Okay, she didn't feel good. She was tired of itching, being irritated down there, having the odor, not being able to be intimate with her husband. Or if she would right afterwards get, bacterial vaginosis. And I muscle tested her, and I said, look, I'm like, you have bacteria, but that's a secondary problem. Your primary problem is you actually have parasites in her uterus. And she turned around and, at this point, she believed me, to a degree, because her friend's son, I was treating he was 4 years old at the time. He was having chronic, constipation. I mean, a 4-year-old boy. Imagine this. This poor kid was going into the ER at least every other month. Okay. And he already had a colonoscopy at this point because he was so constipated. He was already on Colace, Miralax, I think Benefiber. They were giving him prune juice. He was on prescription medications for constipation. He had a colonoscopy. They didn't see anything. They couldn't figure out why he was having this chronic constipation, and he would have to go into the ER like every other month or thereabouts. I don't remember. This was several years ago. And he was going into the ER for enemas. Can you imagine bringing your 4-year-old boy in for an enema? I'm like, the poor kid was probably like, that's hard, and you don't want to see your kids suffer like that. So anyway, this poor little boy, he came in and he was able to pinpoint, like my it hurt right here. He would pinpoint, and I would muscle test that. And I'm like, he's coming up for parasites, and they were like, and the mom was like, well, why is that not showing up? Why is that not showing up like when you do colonoscopy? Because you would think if you're looking into the rectum, you would see parasites, right? Well, not to get gross or anything, but okay, so like here's like the inside of the colon right in here, right? And you have all these outer layers. And then like here is the outside of the stomach, and here's the inside of the stomach. So you have your colon is attached to the inside of the stomach like that. So when we do a colonoscopy, I'm looking through here. Am I looking at any layers of skin or tissue out here? No, I'm not. These parasites actually can embed themselves into deeper layers of the intestine and colon. So you're missing all of that. Okay? When we do a colonoscopy, we're not looking inside, and it's being missed because these parasites can actually embed. Why? I don't know if any of you guys have heard of pinworms, but to test for pinworms, it's not by usually a stool sample, because that stool sample actually has to have active parasites, in that one sample. Just because you don't have it in that sample does not mean that you don't have parasites, okay? It just is not in that one particular sample. So if parents suspected that their kids had pinworms, the doctor would tell you to put tape on the baby's butt or the infant's butt at night. Okay, and then take off the tape in the morning. And a lot of times, if you thought your child had pinworms, itchy butt, always scratching their anus, things like that, the doctor would tell you to put tape on the baby's butt, and then you would see, sometimes you would see pinworms on the tape. And that's typically how pinworms were diagnosed. And just because you don't have it on the tape doesn't mean that you don't have pinworms or that you don't have other parasites. So it often gets missed, all right? And there is just a really definitive test. That's what's nice about muscle testing. Now, anyway, going back to this kid. So this poor kid I muscle tested and was able to say that he had parasites. And I posted this before. I posted the pictures on Facebook before. So it took me, 7-8 months. Like, he was feeling better in the interim. Like, he started, continuously feeling better. But at this point, it took me about 8 months, and he finally started really, really fully passing out these larger parasites. And his mom got a picture of them and took a picture of them and sent me the picture. And she goes, "Are those what I think they are?" And I was like, "Yeah, those are parasites." Now, she didn't save them and she flushed them, but yeah, she took pictures of these parasites. So anyway, the woman who had the bacterial vaginosis knew them, and that's why she believed when I said that she had parasites in her uterus. And eventually she passed those out, and those came out of the vaginal canal. Okay, so parasites can cause other things like endometriosis and cysts. So they're actually known to cause cysts. Okay, so these parasites can go traveling all over and get into other areas of the body. Okay, like I said, including the sinuses and including the head. Okay, so, and there is actually a term, and it is called neurocytosis. Okay, so neurocytosis is when a lot of times these parasites and the larvae, so larvae are baby parasites, okay, and they grow up into being big adult worms, but the baby parasites are called larvae. And when they go traveling, so they don't want to die, right? They want to live just like every living organism on this planet wants to live. Whether they're helpful or harmful for us, they want to live, okay? And they have a mechanism to live too. And this mechanism is forming a cyst or a capsule around them, okay? So that way it's harder for things to penetrate the larva and kill the larva, okay? So they form cysts, okay? So cysts, sound familiar? Cysts on the ovaries, cysts in the colon, cysts in the breast tissue. Just saying. So if you look it up, it's called neurocytosis. So it's when these cysts, these parasites actually go traveling into and travel into the brain tissue or in the spinal column, and they form these capsules. Okay. And these capsules then are cysts. And then when it's specifically in the brain, it's called a neurocytosis. Okay. So, what are some other common symptoms? Like, let's just talk about brain activity. Okay. Epilepsy can also be from parasites, chronic headaches, and migraines. Let's see. There are systemic symptoms of parasites: bloating, gas, diarrhea and or constipation. It doesn't have to be that. Chronic fatigue, anemia. Okay, anemia, especially anemia, and especially because parasites actually they eat our nutrients. Okay, our vitamins and our minerals, causing depletion, causing anemia. So, chronic vitamin B deficiency. Oh, you have a vitamin B. So that's one thing that I love about, Eastern medicine, is we turn around and it begs the question why. Western medicine, and I'm not saying that it doesn't have its time and its place necessarily, because of course if you cut off your arm, you're going to want it surgically sewn. You got to go to the ER, right? But they don't necessarily beg the question why. So if let's just take this. So you have chronic fatigue. I do blood work on you and I say that, oh, well, this is why you're tired. You have iron deficiency and you have B deficiency. Okay, so we're going to give you supplements or some, iron pills and a vitamin B shot. Okay, that's Western medicine. Eastern medicine goes, okay, you have vitamin B deficiency and you have iron deficiency, but why? Why do you have that? Why is that occurring? What's preventing you from absorbing those nutrients? Or in this case, what's sucking up your nutrients, hence the parasites. Okay, so you can also have like heavy metals too that can, block you being able to absorb proper minerals as well. So, and nutrients. So heavy toxins can actually do that as well. And that also opens up the door and the gateway for parasites. Okay, so toxins like break down your defense, your barriers. And then that allows other things to start going to travel, like parasites and things like that. So anytime I see somebody with heavy metals, they always have an underlying parasite, and anybody who's got parasites always has heavy metals in their system. So it's a whole protocol that you have to do. If you think that you're just going to do a parasitic cleanse for 2 weeks and be done with it, wrong. It's not just a 2-week parasite cleanse. I can guarantee you that. And you need to know what somebody's doing, and you need to be seeing somebody who knows what they're doing, because it's not, like I said, it's not just 2 weeks. And then there's also other things. You have to be cleaning up the gut. You have to be getting rid of heavy metals and heavy chemicals as well. So, because otherwise, if you're not cleaning up those toxins, your defense part of your body cannot it's more prone to getting parasite infections, and it's causing other issues as well. So there was a study that was done for on children as well, and they found out that Toxoplasmosis gondii, I don't know if anybody has heard of that. It's a microscopic parasite. And well, they found this in kids who were complaining of headaches and migraines. And they found, and they didn't do, I think they did a spinal tap, and I think they found it in the spinal fluid, because if it was actually in the brain, the only way to really do that is an autopsy. And then they found out that like some inflammatory responses, like IgG, IgM. These are blood work. Um, and you look for that for like allergic reactions and things like that, and antibodies, and there's different blood work that you can do for that. Anyway, they found that some of these markers were elevated, and I think they wound up doing a spinal tap to find out whether this child had toxoplasmosis gondii. But really to only find out if you, because there's no specific test or blood work to determine, you know, unless like I said, you do a spinal tap, but like you'd have to like almost sample like the actual tissue. And what are you going to do? Go in and do like, unless they had like a cyst and they actually did brain surgery and they took out the cyst and tested that. Otherwise, there's really no test to actually test for parasites. Anyway, they did happen to, and like I said, I think it was from doing the spinal tap, they found out that the kids had toxoplasmosis gondii. And some of the kids had this, and some of the other cofactors or comorbidities or symptoms were behavioral disturbances. And we know that parasites throw off neurotransmitters, and so that can change how a person thinks, how a person feels. So anxiety, depression. So a lot of these other kids also suffered from anxiety, depression. Some of them suffered from epilepsy, so seizures. A lot of tonsillitis, strep throat infections, allergic rhinitis. Okay, just like the woman that I treated that had the bacterial vaginosis, the bacterial vaginosis was secondary to the parasitic infections. Once I handled the parasites, and once we handled the parasites, and it took a while, this was not an overnight fix by any means, to really go after these suckers. It can take a good 8 months to a year. And that's the honest, because these suckers have been living in your system, and then you got to break down the barriers and things like that. And sometimes the body, when we kill off parasites have toxins themselves in them. So when we kill them off, they can release these toxins into the body. And sometimes the body needs to take a break from killing off the parasites, clean up the garbage from killing the parasites off. Then it's ready to go back to killing off parasites. So sometimes it's this back and forth process. And your body needs that break for a little bit to kind of clean up garbage from killing off parasites. So it's called the die-off effect. And that's a real thing. And like I said, the body sometimes needs, a little bit of a break. So it can take a while to go through this. But anyway, so just like this one woman who had bacterial vaginosis as a secondary infection, once we cleaned up the parasites, the bacterial vaginosis ceased. She didn't have it again. Okay, and no more antibiotics either. So that's a good thing. So so these kids that are getting chronic strep infections and throat infections and things like that, this can be a result of parasites. These are secondary infections. Because what happens is that the parasites, they have toxins in themselves. They throw off the pH balance in the gut. They throw off the pH balance wherever they're at. Like this one woman, it was throwing off the pH balance in her vaginal canal, allowing the bacteria to replicate. So under normal circumstances, if your pH levels are good, then you're not going to have these bacterial infections, right? Sugar cravings is another sign of parasites. So if you crave a lot of carbs and a lot of sugars, guess what? You're feeding parasites, okay? Along with other things, but you're feeding parasites. They live off of sugar. If you have teeth grinding or clenching of your teeth, that's a sign of parasites. Those floaters that you see in your eyes, if you have floaters, parasites in your eyes. Okay. Let's see. So parasites can encapsulate themselves into joints. Okay. So joint pain. I've seen that too. Nightmares, because parasites are more active at night. They're very active at night. So if you have insomnia, you can't sleep. Okay? And watch around the full moon or the new moon cycles. If your symptoms are worse around these times, the new moon or the full moon, you got parasites. That's a whole other thing that I'll probably do another talk on later, is full moon and parasites. And I think I've done that before, but it's always good to refresh and talk about that. So I'll probably talk about that later. But yeah, if you notice your symptoms are getting worse, you're getting really moody, you're having nightmares, you can't sleep, you're just, maybe you feel like, bugs crawling underneath your skin, you're very itchy, or it's more active at night and you feel like you're very, very restless at night, chances are you got parasites. So what can help with parasites? Well, there's a lot of different supplements out there that can help with parasites. Oh gosh, oregano is a really good one. Let's see, myrrh is good. Clove is really good. Wormwood. So these are some supplements that actually help. Now, what I like, and I don't make just blanket statements on, yeah, these are supplements that can help, but I muscle test my patients. I find out exactly, it's not, there is no one size fits all protocol. Okay. There really isn't. What one person tests really well for, somebody else tests for something completely different, even if they were to have the same parasites. Okay. I find that all the time. And even the dosage changes. So that's one thing that I love about muscle testing is because we find out exactly what your body actually needs. And what's really kind of nice is I've learned through quantum nutrition testing, which is really cool. It actually allows me to see patients long distance, so you don't even have to come in the office. I treat patients all over the place. So, and we still can get to the root cause and get a specific dose and what supplements your body actually needs. So I love one of the products that I really, really love is Cellcore. That's a product line that I absolutely love. I love this. It's called Para 3. I'm pulling this off. So it's a liquid. So this is one of my favorite things. Now, I've had patients where I've actually had them add this into their neti pot or like the Navage, and put it in their, like as nasal rinse. So they've added this in there. I've had some patients that have had, they were testing for parasites in their lungs, and she had a chronic cough. She was not able to sleep at night. She had sleep apnea. She just was not, and she just felt like there was always something stuck in her lung. So I had her add this. She bought a nebulizer. I've been having her do this with a little bit of distilled water, and was able to test her to see how many drops she needed in the nebulizer. Have her doing that, daily. That, the snoring is improved. Her sleep apnea, she's sleeping better at night. Her husband is noticing differences. So, and she doesn't have this, her coughing is less. So yeah, these little parasites can get everywhere. So I love this one. This one is from Cellcore. It has thyme, it's got sage, tansy, stem, leaf, and flower, black walnut hull, holy basil, clove bud, and I'll be darned if I can actually pronounce this, a pet zote leaf. Oh, good Lord. Yeah, so that's Para 3 by Cellcore. What's kind of unique about them is that they have a carbon technology in all of their supplements, which I have not seen in, maybe I'm wrong, but I haven't seen that in any other supplement. So this is, so Cellcore, they also have Para 1. I love Para 1. If somebody's testing for this, I really, really love Para 1. It's Mimosa pudica. This is kind of like it kind of sticks to everything in your intestines and just pulls stuff out like you would not believe. So Mosa pudica, it gets really, really sticky, almost gelatinous type. So it's got to be taken on an empty stomach. But I love, 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 love this stuff. And like I said, they're the only ones that Para One. They're the only ones that have the carbon technology in their supplements. So it's kind of really interesting. So yeah, so those are some symptoms of parasites. I hope that kind of gave you guys an idea. If you would like more information, or if you want to get a hold of us, you can. Our phone number is 708 554 6730. We do have virtual and in-person appointments available. And just FYI, HSA and FSA accounts do pay for appointments, and they do pay for supplements. So if that's something that you're interested in, and until the end of the month, we also have a special. We have 50% off on our initial consultation. And then for so that's $125, and for $199, two people, you and a loved one, because what's better than getting healthy with a friend or a loved one? You and a loved one get a consultation. Normally the consultations with us are $250. This month it's $125, or for two people it's $199. And like I said, HSA and FSA accounts do pay for that. So if you want to know more information, please reach out to us. You can comment in the section, you can email us, you can send us a message on Facebook or Instagram. Love to hear from you guys. Hope that kind of was informative. All right, have a wonderful night, guys.